The Newsday continues here on One News Now. I'm Charles Lejano. The government is looking to utilize malls as the next vaccination centers. Vaccine czar CARLITO GALVEZ Jr. says that instead of putting up drive-through vaccination sites, they want malls to serve as vaccination hubs, as these are readily accessible to the public. Galvez adds that one mall in Pasay City can generate nearly 2,000 vaccine recipients per day.
If we will see na yung geographically, marami tayong mga tinatawag na mga malls that can be used for vaccination center. And yun ang nakita namin na mas sustainable siya and also very affordable at the same time. It is very convenient to the public to go there. So yun namin, more on utilization of the private sector properties so that we can provide very convenient and very accessible vaccination area.
Meanwhile, Health Secretary Francisco DUQUE III said they will submit data to experts to assess if the NCR Plus areas can shift to a more relaxed quarantine classification. DUQUE also said that they're expecting a final recommendation by next week before the current MECQ ends.
To look at the numbers, we need to see whether the average daily attack rate is on a downward trend. It is on a downward trend, but how much longer is it going to maintain that downward trend? Maybe or May 15, we will convene the IATF and we look at the data coming from the analytics group, and if the de-escalation is warranted, then we will recommend to the President from an MECQ to a GCQ, community quarantine status.
2 Filipino crew members of the coronavirus-stricken MV Athens bridge are now in stable condition. That's according to Luisito de los Santos, the OIC for Management Information System Service, the Maritime Industry Authority or MARINA. Santos says the 2 COVID-19 patients are still being closely monitored at an undisclosed quarantine facility along with 10 other Filipino asymptomatic patients. Recall that at least 12 of the 21 all-Filipino crew of the Panamanian-flagged MV Athens bridge that docked at 2 ports in India last month tested positive for COVID-19 at their next port of call in Vietnam on May 1. But health authorities say it's still too early to tell whether the Filipino seafarers were infected with a contagious Indian variant of COVID-19. Biological differences between children and adults naturally lead to differences in vaccine dosage and reaction. But just how different will it be for children, and what are the expected guidelines for their inoculation? Andrew Picash from Johns Hopkins tells us in its Bloomberg report.
Much of the biology of the immune system is incredibly different and very much dependent upon age. Even simple factors such as dosing based on body mass are all factors that have to be empirically determined, and that's why you see these clinical trials now that are focusing on children that are breaking down the age groups into smaller and smaller groups. Remember, adults were basically 17 and above, right? Right now we're going in age increments of about 4 or 5 years or so because of the challenges that are produced by trying to move into those populations with the limited amount of data that we have so far. So very important to get this right, because children represent a population that could really help us move toward a herd immunity sort of endpoint. But the studies that should be coming out next week are going to be very important in terms of understanding the dosing and the side effects in those populations.
And just to sort of tie a bow on this, if we do get those 12 to 16-year-old guidelines next week as expected, how quickly could we see kids start to get vaccinated, and perhaps how much does that accelerate the path to full immunity?
I think you can see vaccinations start almost immediately because the vaccine right now is out there. As we've all sort of been seeing, the vaccine demand is starting to diminish a little bit. And if we look at the initial rollout of the vaccine, my guess is that there'll be a large bolus of individuals who are very willing and want to get the vaccine that will line up very quickly. So I think that the rollout into children initially will be very fast and very high, and then it's really just then going to be a question of sustaining it and getting it to a high percentage, running into similar problems that we see now with the adult population.
Andy, what do you think the biggest issue is underpinning hesitancy at the moment?
I really do think it's getting the information to people in a way that they are comfortable understanding it. From a scientific standpoint, I really am amazed at the wonderful data that's coming out about these vaccines almost on a weekly basis right now. So the data is there. Communicating it effectively to populations is what's really important. And of course, getting at the issue of equity in vaccines, finding the populations that don't have access to it, that haven't heard much about the benefits of the vaccine. Getting to those populations is going to be the really critical thing right now.
Dr. Prakash, what do you think of New York City's decision to advocate for vaccine tourism, that basically if people come here to visit from other countries, they could get a vaccine and get first in line?
You know, more vaccinations are better, and everybody's trying to be, I think, creative about how to do this. You know, bringing someone into a country, vaccinating them, remember, your effect of the vaccine then takes several weeks before you can actually, you know, get the benefits of that. So the timing of some of these things is important. And again, we're allowed to do a lot when we're vaccinated, but we have to remember that it takes some time for a vaccine to actually get you your protection. And so that's, I think, the critical thing to remember as we roll out some of these policies that may allow for greater travel or greater access to vaccines for people who are non-residents.
We'll be back with more stories after a quick break. Keep it here on One News. You're still watching One News Now. I'm Charles Lejano. The Agriculture Department is expected to announce new suggested retail prices for imported pork possibly by next week. Agriculture Secretary William Darth says the agency and the DTI are now computing the SRP based on the lower tariff. Currently, the SRP for a kilo of imported pork casein is 270 pesos, while imported pork belly is at 350 pesos. To give us more details on this, we have on the line Agriculture Department Secretary himself, William Dar. Good morning, Secretary, and happy Mother's Day to you, sir.
Good morning. Magandang umaga po. Happy Mother's Day.
Happy Mother's Day. Thank you for sharing your morning with us. Could you tell us the specific price range that you're eyeing for the SRP of imported pork?
Well, we don't want to telegraph the SRP, so we are still studying and will be brought to the public once the EU is signed.
All right, Secretary, we'll take that, but then when will this take effect, and until when do you intend this to be in place?
Well, this is a temporary measure, and this will take effect once the EU is signed.
All right, let's talk a little bit more about EO 128. How beneficial will this be exactly for the country's pork supply, especially with the Senate agreeing to compromise regarding tariff rates and volume caps?
Now, the new tariff rates as agreed upon in quota is 10% for the first 3 months, and the remaining last 9 months will be 15%. Out quota, the tariff rates 20% first 3 months and 25% the last 9 months. Now, our estimates would be that it will bring prices down 23% level.
All right, that is good to hear. That's a pretty good number for prices to go down. But then does this EO also present any negative implications, especially when it comes to some local suppliers who who might find it hard to compete with the prices of imported products.
Now, this is, as I've said, a temporary measure while reviving and repopulating the local hog industry.
So yes, this is a temporary measure indeed, and we hope we can move forward from this as quickly as possible. But then we're also hearing of certain warnings of more food holidays from local producers in light of this import liberalization. Could we have your thoughts on this, Secretary?
Well, they have been part of the discussions before, so I don't know why, again, they're looking forward to that food holiday.
Right, so thank you for addressing that. But then also, Secretary, we are hearing about the current situation of ASF in the country. Could you give us an update on this and whether there have been any significant improvements recently?
Yeah, very significant improvements in the containment of African swine fever. Let me give you some figures, Charles. The last 4 months of last year, we had a total more than 3,000 incidents of ASF. Comparing it to the first 4 months of this year, 365 incidents. So, an average of that. No, let me repeat para klaro. Yung sa last 4 months, last year, 3,050. If you average it per month, you have 762 per month. The first 4 months of 2021, you have a total cases or incidents of 1,460, and divide that by 4 months, you have 365 incidents per month average. So this is 50% down. We are improving our monitoring and surveillance in this regard.
Right. Again, that is some very good news to hear. Secretary, we just have a couple of questions. We have been reporting that the DA is also currently studying the use of ivermectin against ASF. Do we have any updates on this?
Yeah, that has just started, so we will continue to monitor these trials. There are 2 other antiviral products, so 3 of them are under study. Then, of course, we also mentioned we have now trials on the ASF vaccine. So these are good developments.
Right. Apart from these vaccines, could you tell us a little bit more about the measures that are currently in place to prevent the further proliferation of ASF in the country? Are we doing stricter border controls? How do we intend on keeping these good numbers going?
Yes, border controls are elevated. We are buying more PPEs. We are buying more disinfection facilities via the national highway. So when trucks pass by, they are sprayed upon. So we are also increasing our monitoring and surveillance so that before without the backyard racers knowing na nandyan na pala. So we have this proactive surveillance system. And we have brought the level to the level of the barangay despite against ASF.
Right. One last question before we let you go, Secretary. Let's talk about food supply. Will there be enough food supply even for others such as rice and poultry for the rest of the year?
Yes, sinisigurado po natin na mayroon sapat na pagkain. Kagaya dito sa pork ay pinupunuan nga natin. So overall, we have enough food supply for the country.
All right. Thank you for your time, Secretary. That was Agriculture Secretary William Dar. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.